Good morning, everybody. Quick hello from the International Students and Programs Office. We will get started in just a couple of minutes. We're just waiting for a few more people to join the webinar. Thank you. Okay, good morning, everybody. Thank you so much for joining us for today's webinar, where we're going to be talking about undergraduate student health requirements and insurance for the upcoming year. My name is Gabriella Hoffman, and I'm the Assistant Director for International Student Programs at the International Students and Programs Office. I'm joined by my colleagues Jill Patika, Insurance Coordinator with the UC San Diego Student Health Services Office, and Annie Horton, Nursing Supervisor at UC San Diego Student Health Services as well. They're here to provide detailed and helpful information about undergraduate student health insurance, as well as required immunizations for all new students coming to UC San Diego. With us also today is Argeria Williams, our Special Projects Coordinator and Advisor, who will be here on hand to help answer any questions that come up at the end of the presentation. So here's a quick overview of what we're going to be discussing today. We're going to be doing a quick overview of the International Students and Programs Office. Then we will be going over right into our presentation, talking about UC Student Health Insurance Plan, or UC SHIP, as well as health requirements for all new students. Then we're going to briefly go over some important approaching deadlines and reminders for all new international students. And then we'll leave some time at the end for questions and answer. We do ask that you save your questions to the end of the webinar, and I'll show you in a moment how you can ask those questions. We will answer questions out loud so that the group can all benefit from the answers. We won't be identifying names or anything like that, so it will be anonymous, but we will ask those questions out loud just so everybody can benefit from the answer. Okay, so now for a little bit of information about the International Students and Programs Office, if you're not already familiar with us. Our office is here to assist international students from the very start. We provide pre-arrival information and orientation for new international students, as well as advising services for you and your family throughout the year. You can come to us if you have any questions regarding your international student visa and status. In addition, we offer a variety of cross-cultural programs and activities for all students at UCSD. We're located in the center of campus, so we're very easy to find. And we offer walk-in and scheduled appointments year-round, including the summer. So please come by and meet with us when you arrive. Many of you will already know our office because this is the office where you request your visa paperwork from via the iPortal. So just a quick reminder there, if you haven't requested your visa documents from us yet, please go ahead and start that application so you can get your visa on time to join us this fall. Okay, so before we get going, I'll briefly go over the Zoom control panel that you all should have in front of you. If you'd like to submit a question, you may send it through the Q&A button on your control panel, and it will be sent privately to the presenters and the panelists on this presentation. Again, all of us will stay online for about 15 to 20 minutes after the webinar completion to answer questions. Okay, so now I'm going to go ahead and turn it over to Jill Patika, who's going to talk about the student health insurance plan.
Good morning, this is Jill Batika. I come to you from the Student Health Center on our campus. We are a primary care physician clinic that we take care of the students here on campus. We don't take care of any family members or staff members, only students that are registered with the school. I'm going to tell you what we have to offer at the Student Health Clinic, and then we'll talk about the insurance requirement. We offer services at the Student Health Center, which is located on Library Walk, directly across from the bookstore. We offer physician services. We have registered nurses, nurse practitioners. We have an x-ray unit, a lab, pharmacy, where you can also buy over-the-counter items as well as prescribed drugs. We have an optometry department where we sell glasses and do routine eye exams. We offer health education for different programs. We have an urgent care that's available to students all during the week as well as on Saturdays from 9 to 12. We have an insurance department where we can assist you with billing and different insurance needs. We have a travel clinic. We offer immunizations. We have medical records available, a registered dietitian, and a social worker. And that's our website right at the bottom. You might want to take some time to look at what we offer there. We're open year-round, so we don't have a break. We're here Monday through Friday, 8 to 4 p.m. With an exception on Thursdays, we open at 9 a.m. During the summertime, we do open at 8 on Thursdays, but during the school year, we open at 9. We're closed on holidays. We offer additional hours during the regular school year for our urgent care and pharmacy only. On Mondays and Tuesdays, we'll remain open until 6 p.m. and Saturdays, we're open from 9 to 12 p.m. It is subject to change, but we do like to keep that so any students that have conflicts with their scheduling, they can come in after hours and on the weekend. When our clinic is closed, we offer an after-hours nurse advice line where you can call and get advice if you're sick. They may direct you to the emergency room or to an urgent care facility or ask you to come back the next day or assist you with a scheduled appointment. We schedule appointments by telephone or in person. There are no online resources to schedule appointments, so you need to call in if you want to schedule something or come in and see us. The students are required as enrollees to UC San Diego to have comprehensive insurance that covers them for outpatient care, inpatient care, mental health needs, emergency room services, and pharmacy coverage. As an enrollee of UCSD, you will be automatically charged in the registration process for a health fee. That will be $680 starting in the fall. It's billed to you quarterly through the registration fees. If you look at it at an annualized basis, it's $2,040 a year. This covers you over the summertime as it's included in the spring quarter. So you're covered 365 days. And as I said, we are here so you can come see us if you're here during the summer or during break times. This coverage is offered through Anthem Blue Cross PPO, but it does have a hybrid or a gatekeeper methodology. You have to receive referrals from the doctors at Student Health in order to achieve specialty care or diagnostic services outside of the Student Health Clinic. Referrals aren't required for urgent care, emergency room, or vision or dental coverage. This plan offered through Anthem Blue Cross will cover you for medical and pharmacy, as well as vision, and then they offer you $1,000 worth of supplemental basic benefits through Delta Dental. That's off campus, as we don't offer dental school here. This coverage is worldwide that we offer, so if you're traveling abroad or if you need to go back home on break, you would be covered. It's usually at 60%. At Student Health, you'll be assigned a primary care physician who will oversee your care and hopefully direct you for any preventative services that you might need so you don't have an emergency down the line. But you would go to this doctor and see them, tell them any ailments that you might have, and go over any referral requirements that you might need. If you don't like your primary care physician or they aren't meeting your needs, then you can switch that at any time. So you're not locked into one person. And we offer just about 30 to 35 different practitioners at our campus facility. A written referral is required either from our student health clinic or from our counseling and psychological services in order to achieve specialty care or diagnostic services. Again, there's no referral required for emergency room or urgent care services. A referral is required for you to see a specialist. If you don't have a referral before you go to see that specialist, you would be found financially responsible for those services. We don't provide any retroactive referrals because we didn't see you for the problem that you went to see the doctor for. Referral requirements apply during all school breaks, which means if you're away from the campus, you just give us a call and we can generate a referral for you over the phone. And it doesn't matter how far away you are, you give us a call anyways and we'll help you. And if we're not there, the after hours nurse will assist you. If you have a primary care, or I'm sorry, a primary insurance through a parent or elsewhere through a travel plan, you still need referrals through our student health insurance plan in order to have them pay the appropriate amount that they should. This includes non-emergency care after an emergency. So if you go to an emergency room and the doctor says, we need you to follow up with the specialty department, you call us right away and we'll generate a referral for you to see that specialist and follow up. Accessing care at Student Health means that you are belonging to a primary care clinic and you're not having to go out into the community and seek care elsewhere. We provide a discount for you, so when you come see us under our student health insurance plan, there's no charge to you for scheduled appointments, lab services, x-rays. The things that you would pay for in our clinic would be a copay for a prescription, like $10 or $5, depending on the drug, and a $20 copay to come through our urgent care if you don't have a scheduled appointment. Our pharmacy also provides prescriptions at a reduced rate, as well as the over-the-counter items are about a third of what the community would charge at a pharmacy. We offer a mobile health application in order for you to monitor the claims that may be submitted on your behalf, and to also receive an electronic insurance card. It's an app that you download to your phone, and it's Student Health, all one word, and that'll provide you the front and back of the card, as well as you can monitor the claims experience through Anthem Blue Cross. For more benefit information and details on what's covered and what's not, and what your potential out-of-pocket expenses may be for co-pays or deductible, please visit the website listed below. It's the UC Office of the President, or go to our website at studenthealth.ucsd.edu. Other services that we offer through the insurance plan, as I said, there is a discount for using the student health pharmacy. You're either paying $5 or $10 for a copay. If you go out into the retail pharmacy, it may be a little bit higher. It all depends on what the drug is. And you can transfer your prescriptions to us from outside pharmacies by contacting our pharmacy. They will call out to the pharmacy that you're using and transfer the prescriptions over. Dental coverage is provided through Delta Dental of California. They give you $1,000 worth of supplemental coverage to cover tooth cleaning, cavities, root canals, and tooth extraction. Cosmetic services are not covered under this plan. Vision coverage, they will provide you with a benefit for one routine eye exam per school year. You pay a $10 copay and the rest is paid for by the insurance. If they write you a prescription for glasses or contact lenses, the insurance will apply $120 worth of coverage to the purchase of those glasses or contact lenses. Students who have other insurance and don't want to pay for the insurance through the school, you can file what's called a health fee waiver. You have to do it during the time frames designated. As long as your insurance plan meets our requirements, then we can waive that $680 fee per quarter but you have to file that waiver on time through the Triton link, and that begins on August 1st. The waiver period will run until September 21st. The late waiver period will be open on the Triton link from the 27th, or I'm sorry, from the 22nd to the 27th with a $50 late fee applied. If you don't waive during that time frame, then you will be stuck with the insurance and you'll have to pay that $680 fee. A waiver is required every school year. Students who waive the student health insurance requirement can still come to the student health clinic and be seen there on what's called a fee-for-service basis. So you're paying for the services as you go. One office visit can equate to $120 or so, seeing a provider, getting medication, any x-rays that you might need. So you might want to consider taking a Raft, and we'll talk about that in just a second. But if you do waive the insurance, you can still be seen, but you are on a fee-for-service basis, and it is your responsibility to file any reimbursement claims with your outside insurance. We won't do that for you, but we'll assist you in any way we can, and we can provide receipts and assist you with claims information. We don't provide any transportation to community providers, so if you waive out of the school insurance and you need to go see a provider under your insurance outside of the campus, you are responsible for finding a ride. If you feel like you need to be on the student health insurance plan and you have waived out of it, you can change your mind from quarter to quarter. You just notify us during the open time frame for the health fee waiver, and we'll assist you in making that decision and getting you enrolled or disenrolled. If you do lose coverage, we can file what's called an exception to closed enrollment and get you enrolled immediately. If you lose coverage through a parent, or if you don't pay your plan and you lose coverage, you just notify us and we'll help you get on the student health insurance plan as soon as possible. There's no prorating of that premium, so it is still $680 no matter when you join it, and the benefits would remain the same. If you are going to waive the health fee, you might want to consider picking up a Raft, and that's the last question on the health fee waiver. Raft stands for the Reduced Access Fee for Tritons. It's a basic membership that you pay to get into the student health clinic and not have to pay any additional fees. The Raft will pay for scheduled appointments and lab services that we do in-house without you paying any additional money for that. The Raft is $65 per quarter, and it's just some added peace of mind that you can come into our clinic and be seen and not have to pay for the entire visit. It's not an insurance plan, and it doesn't work outside of the student health clinic. If you have your own private insurance and you feel comfortable in accessing care outside, you can file a health fee waiver and not worry about Raft. But if you are worried about getting off a campus, or if you want to access care at the student health clinic without additional fees, it might be a good idea to pick up the Raft. And you can cancel that from quarter to quarter during the health fee waiver period as well. When you come in through our urgent care on Raft, you do still pay a $20 copay if you don't have a scheduled appointment. In-house labs are at no cost, but if you do require an x-ray, they are $20 per x-ray. But that is far reduced than going into the community and having to pay for those services. The things that aren't included in the Raft, as I said, it's not an insurance. It doesn't cover for prescriptions or pharmacy services. If we have to send a lab out to a specialty lab, you have to pay for that as well. Immunizations are not covered under Raft. You would be paying for those per immunization. And optometry is not offered under the Raft. If you have further questions on that, please look at our website or ask those questions at the end of the presentation. As I said, the Raft is $65 per quarter. That would be fall, winter, and spring. And again, it works all during the school year, 365 days. The summer is included in the spring quarter. When you are on the health fee waiver, it is the last question. It'll ask you if you want to grab a Raft, and it also goes over what Raft is. Take a look at that health fee waiver and see if that's something that you're interested in. And again, it's not an insurance, and it doesn't replace any ongoing insurance coverage or your primary care services. It's the student's responsibility to seek reimbursement through an outside insurance company, but we will assist you with receipts. Other items, and Annie's going to cover the flu vaccine and the clinics that we offer for immunizations here at our student health clinic on campus. Under the SHIP insurance, those would be free to the student, not under Raft, but under SHIP they would be covered. TB screening requirement for the undergraduates is July 15th, and she'll go over that as well with you. If you wanted to pick up an over-the-counter item at our student health pharmacy, we offer thermometers, cough syrup, toothbrushes, cough drops, pain relievers. They are about a third of what the community charges, so you might want to take a look at that. It's always good to have a thermometer so you know if you have a fever or not. And the services that you have at our student health clinic are all payable by credit card or debit card. We don't accept cash or check. If you don't pay for the services when you're at our clinic, they will be transferred to your student account at a later time where you can take care of them there. And if you have questions, we'll wait until the end of the presentation for you then to type them in, or you can give us a call at the phone number that's provided. We also have an email resource there for you at ship3@ucsd.edu. And when you do come on campus, stop by our student health clinic. We're right across from the bookstore, as I said, on Library Walk. This is the waiver criteria that you have to meet if you do plan on filing a health fee waiver for our 2019-20 school year. It's a lot of information. Take a look at it when you have a chance. I have offered, on the next slide, 3 different insurance companies that a lot of our international students tap into to waive the insurance requirement. We do accept ISO care and share plans, and these are all online resources. Student Medicover, which is an elite or a prime plan, will accept that instead of having to pay for the insurance, or PSI platinum or diamond plans. They are good resources that you can take a look at what they cover and see if that meets your needs so you could waive the insurance requirement. Thank you for your time.
Great, thank you so much, Jill, for that presentation. Now we're going to go ahead and move on to Annie Horton's presentation, and she's going to be covering the health requirements for incoming undergraduate students for this coming year.
Thank you so much. Yeah, my name is Annie Horton and I'm the nursing supervisor at Student Health Services, and myself and my team process all of the incoming health requirements for all undergraduate and graduate students. And you will see what these requirements are on your Triton link. Yeah. The general information that we have can all be found on our Student Health Services website that Jill referred to. So all of any piece of information that you need, you will be able to find there. So these requirements are immunization and tuberculosis screening, and the way that you input that information is by going to your student health record via your single sign-on, and the address is up there. And you enter all of your immunization information and the dates online. So we like you to also upload some records, as well as you need to self-enter those dates online. And that is one of the biggest things that we find that students don't do. They upload the record or our form, but they forget to enter the dates online. So if you have any difficulty uploading any of your forms or records, there is also a fax number, both on the form and here on our website, that you can alternatively use. Please bear in mind that we have many students incoming, so we do like to remind you that it can take 5 to 10 days after we receive your forms to process these. You can imagine around deadline times we have thousands and thousands of forms coming in, so the biggest tip for this is get on to these requirements early. There's several reasons why we like that, is that sometimes you'll find that you're missing some vaccines or you need to do some tuberculosis testing that sometimes can take longer than you anticipate. So you will need to see a doctor or a clinic in your own country to ensure that you meet all of our requirements, and that can take some time. The other reason is that Student Health Services is transitioning to new software called an electronic medical health record. So we will be taking some time to familiarize ourselves over the summer. So we don't want you to get caught up in any sort of delay. So we recommend that you get onto these things as soon as you possibly can. We also want to say to you that we are well aware that many countries don't have all of the vaccines that are required, and the main one being the Tdap, which is tetanus, diphtheria, and pertussis. You can wait until you come on campus to receive those vaccines. We give that vaccine in our flu clinic, as Jill referred to, alongside our flu vaccines. So you can receive that easily in a walk-in clinic, no appointment needed, and it will automatically be uploaded into your record to make that vaccine compliant. The other way is, how do you communicate with us? Now, because this is all health information, we really do not want you emailing us, because we want to keep your personal health information as protected as possible. So when you go into your student health portal, there is a button right on the front, and it's also on the front of our website that leads to, it's either ask a nurse or ask a question, and that is a secure way of contacting us. And what it does require, though, is that your UCSD email is in place. If you can actually contact us before that's in place, but we can't respond to you until you have your UCSD email set up. And you get an alert in your email to say that we have sent you a response or a comment. So you might have uploaded and entered all of your vaccines, and we discover that something is missing. So we will send you a message advising you how to meet that compliance. So that is where you will find that. If you aren't getting alerts because Google is not active in the country that you're in, what I would advise is coming back to the student portal on a regular basis after you have uploaded your documents and inputted your information. And the message will be visible in there. So you click on the messages and you will see communications from one of my staff. So the tuberculosis is the first requirement with the first deadline, so which is a deadline of July 15. So again, you go into the student health portal, you click on TB requirement, and it is literally the first thing you will see when you go in there. And there is a series of 5 questions, and it is a screening form. So you answer those questions, and if you come from a country outside of the US, you will be required to do tuberculosis testing. So it asks you to click on a button and download the form. Now you take this form to your doctor, your physician's office, or a healthcare provider to do this. Now the testing needs to be performed within 1 year of entering the university. So if you had TB testing 3 years ago, it is not current. You will need to do it again. So you upload that information once you've done the testing in the same way. There is an email address there. It's just for technical issues. If you are having difficulty with the fax or the upload, that is where you would email. There is no medical related questions that will be answered on that email. You can also check your own compliance, because my staff go through every single one of these TB testing forms, and it will take a few days, so don't upload it and then message us 2 hours later, because we will not have had an opportunity to review that. But in several days, go back into the portal, look for a message, and then you can click on the immunization TB upload button, and you will see whether you are compliant or not. So these are the questions I referred to. So as you can see, for foreign-born students, you do need to get testing. A yes to these questions requires that you do have some additional testing. And this is the form that we require that you use. Now you can, it's very important that you put your student ID and date of birth as well as your name so that we can accurately identify you. Your physician or healthcare provider needs to make comment whether you've had any of those symptoms that you can see listed there or no symptoms. As complete as you can get this form, and you need to probably check that your healthcare provider is ticking all of the boxes, the less back and forward we will have to go and the quicker we can clear you. So once you've moved past the symptoms, you need to choose either a tuberculin skin test, sometimes called a PPD, or the blood test, which is a quantiferon or T-spot, or it's sometimes also called an IGRA, depending on where you're coming from. So you pick one of those. You don't have to do both. Some countries have difficulty obtaining a blood test, so you would opt to go for the skin test. If you have had a history of receiving the tuberculosis vaccine in childhood, or called a BCG, and you know if you've had this, there will be a little indentation on the top of your arm because it leaves a little scar, then we do recommend for accuracy to get the blood test. But again, if you cannot access that test, you may get the skin test, or the other option is you could choose to get a chest x-ray. For students that have had the skin test or the blood test, if either of those are positive, then you must get a chest x-ray, and you have to submit the chest x-ray report, not the films, just the report, and it needs to be in English so that we can read that. And if there's anything abnormal that we see on that report, we will communicate with you if you need to go on to tuberculosis sputum testing, which is very rare. Most students only need to do 1 or 2 of those requirements on that test. And please ensure your healthcare provider signs that form and stamps it or puts their name very clearly so we can ensure that you've seen somebody, a physician. This is the immunization requirement form, and I just want to again remind you, please put your student ID, which starts with an A, on there, as well as your name and your date of birth, so that we can absolutely make sure we have the right student. And on this form, I've tried to make it as clear as possible, so it absolutely outlines what the requirement for each vaccine is, so that you can see with Tdap, which is the tetanus, diphtheria with pertussis, you need to have had an adult dose after the age of 7 or in the last 10 years. So you put the most recent date. Don't put all of your childhood vaccines there, just the date that you've had the most recent vaccine. Now with measles, mumps and rubella, you must have 2 doses, with the first dose being on or after your first birthday. Now, sometimes people have received that first dose before they turned 1, which means that first dose is no longer valid and you need to get a booster dose to have 2 legitimate doses. If you are uncertain of your vaccine history or you cannot obtain your records, then you can ask your physician to do a blood test, and they will. The blood test is called a titer, and it's clearly on the form. We do recommend you take this form to your physician because it will guide them in exactly what our requirements are. The next requirement is varicella or chickenpox, and many countries don't vaccinate for this, and you may have had chickenpox as a child. So what we ask you to do is have a blood test to prove that you have immunity, and that blood test again is called a titer. So you would go ahead and do that. If you come from a country that does have the vaccine, you are required to have 2 doses, with the first being on or after the first birthday, and there needs to be 28 days in between the first and second dose. So if you're entering these vaccines online and you notice it doesn't turn green and it remains red, it could be that you received it before your first birthday, or you received it too close together, the 2 doses. So just check that. But we will also note that, and we will send you a message advising you what you need to do. The last vaccine that is required is meningococcal vaccine. This is for students up to the age of 22. Once you turn 22, you are no longer required to have it, but it is strongly recommended up to the age of 23. Again, this dose, you want to put down your most recent dose. And the dose needs to be on or after your 16th birthday. So if you received it when you were 15 and a half, that won't meet our requirement. Now, there's often a lot of questions regarding the type of meningococcal vaccine, and whatever type your country has is totally fine. And it is the MCV4 or MPSV4, not to be confused with the meningococcal B vaccine, which does not form part of our requirement. Perfect. So thank you so much, and I'll answer any questions at the end.
Thank you so much, Annie, for that presentation, and hopefully that information was helpful for all of you. As I mentioned earlier, we will be leaving time now for questions, but I just wanted to run over a few important deadlines and reminders that are coming up quite soon before we get into that Q&A portion of our presentation. So just to bring us back to some of your other requirements outside of health requirements, if you have not submitted your application for your I-20 or DS 2019 document to get your F1 or J1 visa, please do so now. The deadline to apply for those documents is August 1st, but we recommend you apply now because visa appointments are filling up very quickly. Wait times are getting longer as the summer is the busiest time of the year at US consulates across the globe. So please do that as quickly as possible. A reminder that our next webinar is going to be on June 13th in just a couple of weeks, and that will be our final webinar for undergraduate students. It's going to focus on undergraduate student life at UC San Diego, how to get involved on campus, clubs, organizations, how to get involved in the community. So we definitely recommend you tune in for that webinar, and an email invitation will be sent for you to sign up for that. And just like this webinar, it will be recorded. So if you can't make it, we can send that recording out to you. A reminder from our presentation this morning that July 15th is just around the corner. It's coming up very soon. It is the deadline for the TB information that is due to Student Health. So please go to their website, upload that information, also get started on your immunization requirements information and upload that as soon as possible so you don't have any delays that impact your student record here. Again, September 15th, that's when the immunization information is due to Student Health, but do not wait until that date. Gather that information now. Finally, September 22nd is the International Student Welcome Fest. More information will be posted on the International Students and Programs Office website at iorientation.ucsd.edu. So please keep an eye out for that information as well. Okay, so we're going to go ahead now and open it up to questions. If you have any questions, go ahead and type them into the Q&A box that you have on your screen, and we'll take a few minutes here to answer some of the common questions that are coming through.
Okay, so we've gotten our first question, so I'll go ahead and read it out loud. What is the reporting date for international students on campus? So you have to, you can enter the US up to 30 days before the start date that is listed on either your I-20 or DS 2019 document.
And just to add a little bit more information on that, so the reporting date will also be dependent on your college orientation. So all of you will have required orientations you have to attend for your college. Those are well within those 30 days that Argeria mentioned that you can enter the country. So just be sure that you're here in time to attend your college orientation.
I had a question come in. This is Jill from the insurance department on campus. A student asked if they need to have double coverage or to have two insurance active. You do not. If you have the school insurance, the ship insurance, that's sufficient enough for your stay here in the United States. And as I said, it does cover you globally. But if you are being offered a travel insurance or you're looking into using one of the international coverage insurances, they may cover additional items like luggage or electronics, lost tickets, or if you miss a flight, they may cover alternate services that the health insurance will not cover. So you might want to take a look at our coverage at studenthealth.ucsd.edu to see what we cover, as well as what's being offered to you through a travel arrangement.
Hello, this is Annie here. We have a question regarding, are we allowed to carry and consume some medicines that we've been taking for a long time which aren't available in the US, such as homeopathic medicines for problems like sinus? As far as I know, that's absolutely fine, and many students do come in with their own remedies that they've been using for some time, as long as they're not a controlled substance, that you can bring those into the US with you.
So we have a question come through just asking if we've missed the webinar, any portion of it, can we go back and view it later? And yes, you can. So all of our webinars are recorded. We will be sending out an email with links to watch the webinar. You can watch it, pause it, stop at certain points if you ever need to at your own leisure. So yes, we will be sending out this information along with our other recorded webinars shortly so that you can view those in your own time. Okay, so we have a question about whether undergraduate students need to pay for their orientation, any orientation fees. Yes, the colleges do charge an orientation fee, and I believe it does vary from college to college, the cost, but those fees should show up in your student billing statement on Triton Link. So you can pay those online through the methods that are outlined on the students.ucsd.edu website. So those will show up on your student account. We have a question about which orientations to attend. This is a great question. So there are a variety of orientations that are offered on campus. The most important ones that you should be attending are your college orientations. Those are required. There is also an international student orientation. that orientation is actually going to be offered in the week prior to week 0. So that's going to be offered week September 16th through 20th. And there are a series of workshops specifically for international students on topics that are very relevant to international student questions and topics. We will be releasing information about those shortly. So I do recommend very highly that you attend those, that you should also be attending your college orientations. And then we will have a welcome fest, which is not really an orientation, it's more of a welcome party, a celebration happening on the 22nd that I mentioned earlier, that you can attend as well. So there's a lot going on campus. Highly recommend that you check your email frequently so you'll be able to understand what is required to go to and what is maybe not required but is highly recommended, so you can make the best choices and stay as informed as possible.
Hi, this is Annie Horton here. Just wanted to mention that our deadlines for tuberculosis screening are July 15, and for our immunisation is September 15. I want to say that you do have the first quarter to, part of the first quarter until November 1st to obtain any vaccines you were not able to obtain in your own country. But failure to meet the tuberculosis deadline will result in a hold going on your account, which will prevent you from enrolling. So that is very, very important because we are trying to prevent active tuberculosis cases from coming onto campus. For the immunisation, you have until, as I said, November 1st to obtain all of your missing vaccines that you weren't able to obtain where you come from, and then the full quarter on November 1st, if you haven't obtained them all, a hold will go on, preventing you from enrolling in the winter quarter. So it's very imperative that these requirements are met in a timely manner to avoid holds going on. It can take up to 24 to 48 hours for those holds to be lifted. It can mean that you can't get the classes that you want if there is a delay, if those classes have a high demand. So we really want to support you to meet all of our requirements in a very timely manner to avoid any problems with enrolment holds going on. So please reach out to us if you're having any difficulty understanding any of the requirements that you need to meet. Thank you. We have a question here that says, for meningococcal vaccine, does it need at least 2 doses? The form only says that the most recent date must be on or after the 16th birthday. Yes, you only actually need 1 dose to meet the requirement. Unlike measles, mumps and rubella and vaccine that actually asks for 2 doses. We put that there because students have often had earlier doses, but when it comes to inputting it on the online form, just put your most recent dose that is on or after your 16th birthday.
Okay, so we have a question that's come through that's related to travel and entry into the United States as an international student. This is a great question, and actually something that we're going to cover at the beginning of our next webinar, pre-arrival procedures and such. But I do want to kind of touch on it now because I know some students are going to be arriving already starting in the summer for summer session classes. So the question is, after we enter the United States, what procedures do we have to go through at the airport or afterward before fully starting our sessions here as international students? So it's kind of a two-step process. Obviously, when you come to the United States, no matter where you enter the US, for example, if you have a connecting flight, if you, let's say, land in Chicago and then take another flight to San Diego, whatever first point of entry you have in the United States, that's where you will be required to show your entry documents that allow you to be here as an F1 student or a J1 student. So when you get to the border, you may be asked a series of questions, or you might have a very quiet Customs and Border Protection official at the border. It really depends on the CBP officer. But generally speaking, we just say that, make sure you have your I-20 document with you. You have your visa with you in your passport. Have those, do not pack your I-20 in your checked luggage. Be sure it's with you. Hand those to the officer. And if he or she has any questions, you can just state the reason for being here, which is you are a full-time student pursuing whatever degree it is you are pursuing here in the US. Sometimes we recommend students bring their offer letter, a printout of their offer letter to UC San Diego, just to provide additional evidence as to why they're here. And you can just explain that you're a full-time student pursuing a degree here at UC San Diego. It should be that simple. They should let you through from there. But if they have any additional questions, that does happen sometimes. So just be, polite, be prepared to answer any questions that are asked. We don't recommend offering information more than what is asked of you. You are not obligated to do that. But generally speaking, that is the most basic procedure for entering. And then once you enter the United States, it's really important that you make sure you entered in the correct status. As I'm sure you're aware, millions of people come through the United States every day. And so sometimes mistakes are made by Customs and Border Protection. So it's really important when you enter the US that you check what is called your I-94 record. And more information will be sent to you about this. And you'll log into your I-94 record online within about 24 hours to check that you were entered in the correct status, to make sure that you were entered as F1, as a student, and that you are allowed to be here for the duration of your status. Because this is such detailed information, I know I'm going over a lot right now, we are going to be sending this information to you over email. We will also be going over it in a future webinar with screenshots to explain. But first and foremost, just make sure you have all your documentation with you, and you should be good to go to enter the US at the port of entry. There's a question about having trouble finding recordings of the past two webinars. So we did have some difficulties with the recordings of the past two webinars that we had that we're currently working on updating those. So those links were sent out, but I know the recordings expired, so some students had issues getting them. We do still have those recordings, but as I mentioned, we're working on updating those and posting those to the website, and we'll be sending that link out so you can view those whenever you are able to. Okay, so if there are any further questions, now is your time to ask. We will be finishing things up here only online for about another minute or so. So if you have any urgent questions you want to ask Annie or Jill about health requirements or immunizations, please go ahead and do so now. Otherwise, we'll be wrapping up in the next minute or so.
This is Jill. I received a question. Does SHIP plan also cover insurance during travel within the US? And yes, it does. You are still required to get referrals as you need to, but if you have to go to an emergency room or urgent care or pick up a pharmaceutical, you would have coverage for that at the same rate as you would in San Diego. You just have to follow the rules, and the plan is nationwide as well as global. So the insurance company Anthem Blue Cross is recognized in all 50 states in the United States. Thank you.
Okay, so we have a question actually about the visa process. After applying for your I-20 document, what else are you supposed to do regarding your visa, and how much time will this whole process take? The answer to that is it depends. So there are certain things that we can tell you, certain deadlines and processing times. I can tell you that after you apply for your I-20 document, it will be completed within 15 business days. That is 15 days. Once you receive your I-20 document in your home country, you need to apply for your visa. And the entire process for applying for your F1 visa is outlined on our website here. If you go to inewstudent.ucsd.edu, if you hover over new students, there is a tab that says applying for your US visa, and it walks you through the steps of what to expect. On that link, you can see how long it takes to get an appointment, as well as how long it typically takes to have your visa processed. And again, it depends on country to country. Some have faster processing times, others have longer wait times. There are fees involved, so you do need to pay a visa fee, a CVIS fee. Those fees are outlined on our website and on the links that are listed there. So be sure to review that thoroughly so you understand what to do after you receive your I-20 document.
Jill again. I received a question. Does the insurance cover international travel when we travel home during breaks? Yes, the Anthem Blue Cross plan is a global coverage. What students generally do is they receive the care in their home area or in the country that you are traveling to. You have to pay for those services up front and then bring your receipts back to the United States, and will assist you in filing a reimbursement claim. And generally, the insurance plan recognizes that at 60%. Which is good if you think about it. The US is the most expensive healthcare entity. So if you're traveling outside the United States, it's usually a little bit cheaper. So yes, you would pay for your services and then seek reimbursement once you're back in the United States.
Okay, so that completes the question and answer portion of our presentation and our presentation today. Thank you all very much for joining us, for asking these great questions. As I mentioned, this has been recorded, and the recording will be sent to all of you via email so that you can watch it again whenever you have the time, whenever it suits you. If you have any other questions, please do contact us. Please visit our website, inewstudent.ucsd.edu. It is full of information and checklists of things that you specifically as an international student need to complete before you come to UC San Diego. And if you have any questions, you can call us. The phone number is listed right there on your screen. You can also contact us via email by going to icontact.ucsd.edu. We do aim to respond to students within 3 business days of their request. So please go ahead and submit those questions if you have them. Thank you all again very much. We look forward to seeing you at our next webinar and hope you have a great evening or day wherever you are. Thank you.